Till now, we have been talking about climate change only from the perspectives of the causing factors, the emissions. Now, its impacts we only spoke about in terms of the big disaster or the disruption of the climatic cycle. Now, actually, if you look at it, we are going to the next and say what it means when the climate cycle is wrong. You know, climate is everything. If climate changes, everything changes, whether it's a mosquito, it's a bacteria, it's a vector, or anything else, everything is changing now.
Any emissions during outbreak, we need real-time data collection so that we can have our proper information systems in place. Also, we need to evolve our early warning systems. So, if we don't have these in place, plus if we do not have the training of the or the capacity building of the public health workforce simultaneously, so that they understand what that data means, they understand what are climate sensitive diseases, they understand what is the seasonality of these diseases.
We have at the state level, we have provision of multi-sectoral task force, and the same at the district level, where under the guidelines we say that a health person, a principal secretary of health should lead at the state level and invite other sectors, and they plan the state level action plan on climate change and health, not just climate change and health, and the same for district level.
So I think the biggest gap is how you take all those action plans to the ground and get them implemented in efficient manner.
How do we bring the communities that are the agents for bringing change on ground into this conversation? So I would essentially say it can be across 3 pillars. So we say that even for developing national global action plans, we have 3 things. We need to have data and evidence, we need to plan, and then we need to communicate it. If they involve community, we have a huge community. If we have those set of volunteers that can hold the baton for us, collect these data, form at least a major part of these documents, and then the government can formalize it and pass it on to the state. They can review it, pass it on to the nation, and that is how bottom-up approach and planning can work.
As health community, what do you think we should be doing in terms of creating that linkages with the climate science?
The health sector wants to integrate. They are also realizing that to address the challenges of health, they need to understand its linkages with environmental factors, its linkages with climate change, and like Dr. Purvi said, they are also focusing on making the health system itself resilient. It is not only the adaptation that they are looking at. They are also focusing on mitigating their own emissions and all. I'm pretty positive that those interactions are happening and there is a willingness from both sides to work together.